watching Let's Chat.
You don't have to be a rocket scientist to figure out smoking is bad for you, bad for those around you. But you may not know just how bad smoking is if you are pregnant. Joining us to talk about that is Lisa Vincent and Charlene Roberson. Both of these ladies are with the Hamilton County Health Department. Ladies, good to have you here.
Thank you.
What is so new and so significant about this study that apparently just came out concerning smoking and pregnancy?
Previous studies have shown us a strong relationship between smoking, maternal smoking, and sudden infant death syndrome. This new study that came out has actually been able to quantify that. In 2011, they started including previous smoking with the mom. Does she smoke or does she not? How many cigarettes has she smoked in the previous 3 months to pregnancy? And how many cigarettes she smoked during each trimester of the pregnancy on the birth certificate data. So researchers were able to actually look at the quantity of cigarettes that the mom smoked during those time periods to show us the effect of the number of cigarettes and the risk for sudden unexplained infant death.
Charlene,
Yes.
pick it up from there.
So in order to combat this issue, we have the Baby and Me Tobacco Free program, which is a tobacco cessation program for pregnant women in Hamilton County. In order to qualify for that program, you have to be a pregnant smoker or quit within the last 3 months of becoming pregnant. And in that program, you'll have 4 prenatal appointments, and then once you have the baby, you'll move on to the postpartum phase of our program.
Why do you ladies think it is so difficult to quit smoking? Eric Clapton once said in an interview years ago, "I kicked heroin, I can't kick cigarettes." Why is cigarette smoking so addicting?
Nicotine, it's really the nicotine, and the cigarettes that people smoke now have a much higher concentration of nicotine in them than cigarettes of a few generations ago. So the tobacco companies actually pump up that nicotine, and it is an addictive drug that is in the cigarettes. So people are far more addicted to the actual effects of the nicotine substance.
And the effects of that go a lot further than what you might think of off the top of your head, correct?
Correct.
Yes.
I mean, and it goes, if you go into a smoker's house, you can smell it pretty much everywhere, on their clothes. I mean, even clothes that are hanging in a closet that haven't been worn for years. There's just a different, you know what I'm saying?
Yes.
It's just kind of a different sort
And
of
that's
situation.
called third-hand smoke. The particles and the chemicals that are in the cigarettes that are left behind on the car seats in the car or the couch or the paint on the walls, the drapes, that's third-hand smoke, and that's also dangerous to be around because the chemicals are present there. So for example, a person caring for an infant, even if they go outside to smoke, the nicotine and other chemicals in the cigarette are embedded in their clothes.
Right.
So we recommend that they change clothes before they handle the baby, wash their hands, and limit that contact for the baby with those chemicals.
A lot of this anti-smoking is socially related. 50 years ago on TV and the movies, everywhere else, everybody was smoking, but thanks to a lot of research and a lot of intelligence and more than a little common sense, people are finally seeing the other side of that coin. Let me ask you this, for the pregnant smokers who are going to attend this Baby and Me program, what is in it for them other than a cleaner, healthier lifestyle?
So once they become smoke-free, they receive a $25 diaper voucher for Walmart for any size and any brand diapers that they would like. So they would receive 2 vouchers during our prenatal period and up to 12 vouchers during that postpartum period of the program. So they can receive vouchers up until the baby turns 1.
Wow, and that adds up to a lot of money in
Yes.
diapers.
It does.
It really does. Anything else we need to know about this?
The partner also, so if they have a partner that smokes, because we want to limit the contact that the baby comes into with the smoke, if a partner signs up for the program and comes to the sessions along with the pregnant mom, they can also receive a $25 voucher. So the family can actually get $50 worth of diapers a month once the baby is born.
And when does the Baby and Me program kick off?
The Baby and Me program had started in 2014, so it is currently in session. So if you qualify for the program, be sure to contact us at the Hamilton County Health Department.
All right, Lisa, Charlene, thank you both so very much. And you can find out more by checking out the website at the Hamilton County Health Department. Of course, they're down there right beside Erlanger. Ladies,
Great.
thank you so
Thank
much.
you for having
Thank
us.
Good to see you both. Y'all come back anytime. And you make sure and rejoin us right after this commercial break for more of Let's Chat.